Hi, so today we're gonna talk a little bit about this filler and a little bit about the face and the oval. So we're gonna start with Starfield that we have three presentations. We have the Plus, the D Plus, and the Implant Plus. What I like about this filler, it's easy injection, it's safe, and the cost is really good. One of the things we need to know about it is that it's really safe because it has a low MOD, which it means that it has a low BDD, and that is really important when we choose a filler. And it also had complex viscosity, and it's easy to inject. One important thing about this is the manufacturing, that it has the 9 essentials, that it promised us to have the quality and the safety for our patients. And what are the 9 essentials? We have the raw material that is controlled and separate lines. We have a highest purified HA that guarantees the duration and prevent from the swelling. We have an optimized viscous elasticity that it gives us that lift up that we want to do in our patients when we do the cheek or the contour. And we also have the technology with the molecule that is homogeneous, so it's really good when it molds in. We also have a low BDDE, almost until 0. That's really important when we choose a filler. And also the aseptic manufacturing, and we also have the endotoxin to 0.1. And when we inject this filler, it doesn't hurt to our patients because it has the same pH and osmolarity as our body. And we also have the precise injection when we do our procedures. When we talk about the purity of an HA, we need to know that there's a micro, a middle, and a macro molecule. And the one that we want is the middle one because that's the best one to give us the stability on the body. When we talk about a macromolecular, normally it absorbs a lot of water, so we can have an edema that we don't want on the patient. We have a great viscosity and elasticity. That's what we want to have when we have a product to inject to our patients, and it keeps the natural shape for our procedures. As I told you, we have a harmonized particle, so that means when we inject our patient, it's really easy to mold in. So let's say you do some lips and you stay a little superficial, but when you do the massage, it's gonna blend in to the patient and the patient won't feel any bumps. So you're safe to go with this. We talked about the endotoxin and the BDDE. It's really important to have a low endotoxin and a low BDDE because that means we're gonna have less inflammation and less allergic reaction. We can see here the cross-linking, and as I told you, we have a low BDDE compared to others, but that means that we're gonna have a great filler and still have the great shape and natural shape. When we talk about a filler, we need to see 3 things: the endotoxin, the BDDE, and also the protein load. Compared to other fillers on the market, as you can see, we have a really low endotoxin, so that means we're gonna have less edema. The BDDE, as I told you, we have a great process, so it's almost until 0. And the load of the protein, as you can see, we have 2.7. So these are some of the things that you need to know about the fillers when you choose one to use on your patient. We have compared to different types of fillers. As you can see, we have the lowest mode to a 25 to a 30% compared to the others on the market. This article is important because it talks about the importance about the mode that we need to have it low on our patients because that gives us the quality and the safety for a filler. This is a data that we have compared to others, and the swelling, as you can see, when we use this type of filler, is not as bad as other fillers. When we choose the filler or which area we're going to inject, this is really important because depending which area, the chin, the lips, or the under eye, is the filler that you're gonna choose. So depending what you want, if you want to give a lift up, if you want to give a volume, or maybe if you want to only give irritation, you need to know the rheology of every filler that you're gonna use. We did also some comparisons with other fillers, and as you can see, it had the same effect in the 8 weeks, 16 weeks, and 24 weeks. And the patients were really satisfied with these fillers. Compared to the 8, 16, and 24, every patient was satisfied. As I told you, we have 3 presentations, and depending what you want to do with your patient is the one that you're gonna use. If you want maybe to do the lips, but something really natural lips, you could go with the plus lidocaine. If you want to have the Russian lip, maybe you could use the Deep Plus. And if you want to give volume or projection, then you can go with the Implant Plus. This is a reminder of the aging of the face. We have skin, we have bones, and we also have the fat pads. Remember, when we start aging, everything changes, not only the skin, not only the fat pads, not only the bones, and the ligaments. So depending on the age of our patient is what we are going to do. Normally, when we feel our patient, it's because they are starting to lose the fat pad. If our patient has volume on the face, obviously, we don't want to overfill our patient, and we could use other treatments to treat what our patient needs. Something really important is always remember the anatomy and the danger zones when we start to inject. Remember that we have the facial arteria that goes really, really deep, and then it starts to go a little more superficial, then we get the lips, and then we get the nose. Everybody, or a lot of doctors are really scared to inject the nose because it's the triangle of the death, but just remember to know the anatomy really good, and when you are in the nose, well, on my experience, I always aspirate before I inject. When we talk about the balance of our patient, we need to know the angles, depending on what they need. Because sometimes you have the patients that come to your office and they want something, but they don't need that. So it's important to know the balance and the harmony on the patient and also the angles, because we are not going to give them chin if they already have chin. We're not gonna give them cheeks if they already have cheeks. So depending on the angles or what you need, what you see under patient needs, it's what you're gonna do. Everybody in social media nowadays, they want Russian lips, the hearted lips, but it's really important when we have the patient with us, explain that there are different types of lip, that not everybody can have the hearted lip. Sometimes we have the full lip, the wide lip, the thin lip. Another thing that I see a lot in my consult is that sometimes they have really thin lips and they want to have the big lips. But to get to that lip, you have to do it in sessions, not just in one session and put 2 syringes of hyaluronic acid, because then you're gonna get migration and you're gonna get edema. So always explain to our patients. Now, nobody wants the pillow face. So remember, if you have a patient that already has the cheeks, already has the chin, then do not overfill them, because right now, nobody wants to be like that. We have to teach our patients, not what they want, but what they need. As we can see, some celebrities, they had natural face, and then they had the pillow face, but right now, everybody is dissolving their faces because they don't want any pillow face right now. And I always say, in our field, less is more. It's not just a trend, but a medical method which drop of hyaluronic acid is guided by anatomical knowledge and artistic mission. As I said, everybody wants this, less is more. Right now, what we want in our patients is something really natural, that no one can identify if they have fillers or what treatment they have. We want something fresh on the faces of our patients. These are some of the results with this filler that we had before, 1 day after, 1 month, and 3 months. Obviously, as you know, you can see the quality of the skin has also changed because we know that the hyaluronic acid helps us for the irritation. And you can see how the filler suits really well. One of my favorite things to do at my consult are the lip fillers. This patient, I work her with Starfield Plus. They wanted something really natural. As you can see, you can give them a really natural aspect. And this one, as you can see the difference from the picture before, how they have a little more harder shape. And this lip is a little more longer, but still we could make the Cupid arc and like the heart here. And I worked her here with a Deep Plus, which is a filler that is going to give me a little more volume because my patient did want to have a little volume. And since it's a longer lip, I work her with that one. Here I have another patient. I did her some nose, some lips, and some chin. In her, I did the nose and the lips with the same syringe. As you can see, the nose is a place where you can put little amounts but have great results. And then I did the jaw contour and a little cheekbone with the implant tip. I have another patient. She wanted something real natural. I did combining techniques. I did the jaw contour. I did a little of the cheek. And you can see from the first picture and the second picture, she has a little more cheek. When we put the cheeks on our patient, it's really important to see if they need volume or projection. And it's where we're going to decide where we're going to put the correct filler. This is another patient. I did the full face. We did a little nose, a little lip, a little chin, and a little jaw contour. I didn't use more than 4 syringes with her, okay? And this other patient, I did the nose. I did that with the Deep Plus. As you can see, it looks really nice, really natural. And she has harmony on the nose. In conclusion, always before we inject, we need to know our anatomy. That's the most important thing. When we inject danger zones, always aspirate no matter what. Use a small amount to make great changes. Remember, less is more, and it's not just about fillers, it's not just about skin quality, it's not just about technology. Remember, it's a combination of treatments you want to do on your patients to have the best outcome for them. And always remember, in aesthetic medicine, less is more. It's not a limitation. It's a principle rooted in anatomical respect, clinical precision, and the pursuit of natural, harmonious results. Thank you. No, not tranquila.
Okay, we will start live demonstration. Thank you, Dr. Mariana, to start,
Okay,
if you are
perfect.
ready.
Yes.
Thank you.
So we're going to start our demonstration. We have a lovely patient. We're going to sit her up. When I inject, I always sit my patients. I always mark my patients sitting up because it's different when they're laying down and they're sitting straight. Gravity does its work, okay? So we have our patient here, and we can see that she has this saggy, which is the yaw, okay? That place you're never going to inject. When we have volume, remember, fillers gives us volume. We don't want to give more volume when we already have volume. Okay, so this place we are not injecting. How I do it and how I mark my patient is with my marker, like this. That's the place I'm not going to inject, okay? So I mark her. And always are visual effects, okay? That's really important, that the fillers are visual effects. So when we inject here, we're gonna have a visual effect that it's going to project. And also, I'm gonna put a little jaw contour because she wants something really natural. Remember, she's a woman, and women go more natural than the men, okay? Men are more square face, women are more triangle face, okay? And just a little here to give us a little lift up, okay? And remove the volume from here. When I mark, I always put my finger, and I feel the angle here, and here, okay? And we're in a safe zone injecting because remember, the arteria is, the masseter is here, and the arteria goes straightly here, deep. But actually, we have volume there, so we're not going to inject anything there, so we're safe to inject. Okay, lay down. What I'm going to inject with is my Implant Plus. As I told you, this one is to give you volume and to give you more projection. Okay, so I'm gonna open my product now. Starfield. Okay, so when I inject the cheekbone, I like to do it with my needle. I don't like to use cannula there, or I do it with my needle. Can I get a, yes, yes. Thank you. And what I do is, thank you. Okay, we're gonna start. Okay. So I always, when I inject, I always do this to my patient, okay? I like to put my needle up, okay? So you go a little pinch, pinch, okay? And there I feel my bone. Normally when you're in the bone, you're in a safe zone, but I always, as I told you, I like to aspirate a little just to make sure you never know the variant anatomics, okay? And I deposit. Now, when I deposit, and then I bring a little out my syringe and leave a little deposit when I'm going out. Okay? So we have there the first one, and the second one. There we go. And always aspirate. Remember that sometimes when you inject there, you can go there and don't feel the bone. Never deposit if you don't feel the bone. And I deposit and bring out my needle, and that's great. When I did those points, and sometimes, depending on my patient, I go a little downward here and put a little point to give a little more of a lift up. Okay, picadito. I don't go straight, I go a little up. Okay? And then I aspirate. And then I deposit. Presión. She's gonna feel a little pressure, it's normal. Bring out. So you can see it's just a little lifting that we did. After I do the lifting points, I go on my angle, okay? And I need to feel the bone. where I feel right there the bone, I like to put my first point with, or my first injection with the needle, okay? So we can mark the angle, because sometimes when we use the cannula, we cannot mark that angle as much as we want. So if you want to have a sharp angle, you can put there the first injection and mark it. How much? It depends how sharp you want to give your patient. If you're working with a male, you can put half a syringe. If you're with a woman, obviously less. My patient doesn't want a sharp angle. She wants something natural. Okay? So I feel the bone structure here, okay? And I'm gonna deposit a little. Fíjate. She's gonna feel a little pressure. There. Great. I aspirate. And I deposit. When you go in, depositing, go slow, remember. This is nothing that you need to rush. Just slow. 0.3. I did a 0.3 there. 1, 2, 3. Okay, now I'm going to change for the cannula. Ajá, sí. Sí, porque no hay 25, ¿verdad? 22. Ah. Okay, vuelta tantito. Okay, so remember that I'm not going to put anything where we mark where there's volume. We're going to put some here. Let me see. There we go. We're going to put some here. I'm going to deposit straight and lift here, and then just a little here. If you want also to have like a more sharp angle, you can deposit 1, 2, 3. In her, we're going to work something really, really natural. So I'm going to deposit right where the first point was here, then a little here, and then come back, and on la línea, put a little more, okay? But remember, if she is a male, what you can do is put a little here, and do some lines, okay? And leave a deposit, so we can have a more marked masseter if you want. But in this case, we are only going to put here, here, and just like a linea here, so she looks really natural. Ligadito. Mete aire. Okay, I did this. Remember, when we go in, we want to do it a little superficially. If we go deep, you're gonna lose all the filler and you're gonna need a lot of more amounts. But when we go a little superficial, it's better because we're gonna have a better result, okay? And always, when you use the cannula, where it goes the product, it needs to go up, okay? Not down, because then you're gonna leave all from the skin all the way where you're not gonna be able to project as the same. So we're in. See how we're not that deep? And we go into our patient. What is that? Okay. And there, if I put my candle out, you can see it perfectly, okay? And there, I'm gonna leave a point. Leave a point. And as I told you, I go out and deposit the rest there. There we go. So we only use one syringe to project a little here. Okay. Cambiaré. Sí. Sí, one more. Just to do this single and we're finished. See. And just for this part, sorry. Voy a picar, ¿eh? Sí. Go this, pícate. Sí. So we inject this with a cannula. Great. Molestia. So remember, we have the ligament here. There we go. It's gonna hurt a little. And we deposit. There we go. And now you can see on the camera how we can see the jawline really natural. And we only use 1.5 syringe. So I'll do the rest off camera. Sí, ¿te dolió mucho? So, guys, see that? Sí. Y voltea. Como. Sí, qué bueno. Voltea. We have, I think, 10 minutes. Levanta. There? Perfect. So if you wanted to do just a little projection, then we could put just a bit here on the chin, and she will be balanced perfectly.